right. The next question is, do you have any experience with treating vulvar lichen sclerosis with LDN? And is there any reversal of scarring and or discoloration? The first answer is yes. So when we're dealing with a topical autoimmune issue, whether the lichen is in the mouth or in vulvar tissues, sometimes it's due to a toxin exposure. So for example, like mercury amalgams, silver fillings in the mouth can cause a trigger. But usually there's some autoimmune relationship with lichen. We still want to use an oral medication because you need the oral LDN to help modulate the immune system. You can still use a little bit of topical LDN as well. Now, as far as the scarring and the discoloration, LDN will reduce the inflammation. So depending on what base that topical LDN is put in, we can use it to also help reduce scarring and or discoloration. We have seen that many times. We would use a very small amount of the topical as needed for itching or that funny tingling that goes along with the lichen sclerosis. Whether or not it lightens the area really depends on the pigment of the skin to begin with. So lichen is a very, I don't think there's a lot known about lichen sclerosis. I think there's a lot of questions still surrounding lichen sclerosis as to how it really affects most people. But I will say that LDN doesn't necessarily bleach the tissues. So it doesn't take pigment out of the tissues. We have other medications that can help with that can be combined with a topical LDN if you're most concerned about discoloration of the skin due to the lichen. But I think anytime you reverse or at least minimize that inflammation around with that scarring, perhaps the discoloration will subside as well. You want to add anything to that, Sam?
I would just add that lichen is really hard to treat and it's not a short-term fix. I mean, people might not see benefit for 6 months sometimes. It eventually comes, but it's very tricky to treat and it's a long-term type of situation because you got to have a lot of patience with lichen.
Right. And would you agree that you really have to use the oral, right? The topical alone is not going to handle it.
Yeah, I've seen topical sometimes even up to 4 times a day, but they actually benefited more when they added an oral because it is an immune type of situation.
Right. Yeah, absolutely.